The median age is 84 and the mean age is 81. In terms of admissions to intensive care, 411 to date. Currently, as of this morning, 35 in intensive care, including one new admission in the last 24 hours. And their total, as of 8 a.m. this morning, 122 people with confirmed COVID-19 in hospital beds. The total number of incident cases as of midnight, Saturday just gone, 25,198 at that moment. 3,322 had been hospitalised at some point, that's 13.2%. 411, as I say, admitted to intensive care, that's 1.6%. The male-female breakdown is unchanged as 43% to 57% respectively. The median age is 48 and 32% are accounted for by healthcare workers. Just some additional data in relation to residential care facilities and nursing home clusters. 475 notified in respect of clusters of residential care facilities, an increase of 5 since last Friday evening, 258 of which are in respect of nursing homes, an increase of 1. In terms of cases associated with those clusters, 6,797 cases, an increase of 61 in respect to residents of residential care facilities, 5,232 of which are in respect of nursing home residents, an increase of 48. In respect of deaths, residents of residential care facilities account for 1,064 or 63.2% of total deaths. 933 or 55.4% are in respect of residents of nursing homes. Just in terms then of the additional data we have a little earlier in the week in respect of clusters and other settings, in respect of Roma, no increase in the number of clusters or cases in that group. In respect of travellers, no increase in respect of either cases or clusters. In respect of direct provision, 1 additional cluster notified, 4 additional cases in total. In terms of homeless institutions, no increase in clusters or cases. And then in respect of workplaces, a total of 47 overall, which is an increase of 4 clusters, 22 in respect of meat plants, an increase of 2, and the total number of cases involved, 1,091, an increase since the previous week of 43. So we're happy to take any questions, Richard.
Tony Richard Chambers from Virgin Media News. Just on the number of new cases confirmed today at 9, that's the lowest it's been in almost 3 months. How significant is that figure? And do you worry with this good news and with the news, of course, released that we are now in phase 2 and we have a clear roadmap in terms of travel restrictions ending on the 29th of June? Do you worry that people will see this as mission accomplished, that the worst of this is over, that things are almost in a way back to normal?
Mission has not been accomplished. 9 obviously is a small number in relative terms compared to some of the numbers we've given you before. Always, I'll stress, on a Monday there's a weekend effect sometimes in terms of not just reporting but people's attendance at health services and so on, so it won't surprise me if the number tomorrow is a little higher than that. But overall we've seen a continued decline. Each of the 3 previous days we've reported less than 30 cases, so you'd have to go back to Thursday before we had a number higher than 30. And so all of the disease parameters that we've seen are still continuing a downward trajectory, but we're keeping a close day on daily eye on those, including on admissions to hospital, admissions to intensive care and other important parameters. But no, we have 2 more phases to go. We're in the second phase now of the easing of restrictions. We gave advice to government on Friday arising from our meeting of NPHET on Thursday. We were clear in our view that we needed to continue the eased and phased restrictions, easing of restrictions, but we advised that we thought on public health grounds, given the experience we've seen in this country and given the experience that has been observed in other countries, particularly across Europe, that we advised that we could and should rephase, as it were, the remaining restrictions across 2 phases, and that's work that we will do over the course of the next short period and give further advice to government in relation to those final 2 phases. But we're only halfway through this.
Okay. The Business Minister, Heather Humphrey, says the 2-metre rule might not be necessary in all circumstances in the hospitality sector should the infection rates drop further. Is that worrying from a public health perspective, that this might be something which people are concerned about, that this hasn't been taken seriously enough, that things are opening too quickly, that measures which we were told are essential might soon be taken away?
So on the question of things moving too quickly, we think that the pace is right. In fact, we gave the advice, as I said, as part of our NEFIT meeting on Thursday, that we could rephase the remaining 3 phases into 2 phases, because we felt that the time is right, the experience we'd observed in other European countries, our own experience in terms of the progress of the disease and so on. We felt that now was the right time for us to recommend that. There's always the possibility that we're not correct. There's always the possibility of anticipatory behaviour of a kind that we're not recommending, leading to a further increase in cases, which is why we don't just recommend the easing of restrictions, we continue to watch the disease very, very closely. If there's a change in the behaviour of the disease, we will give advice that will enable us to deal with that. On the specific question in relation to the hospitality sector and the 2-metre rule, that again was part of the advice that we set out in the letter that I wrote to the Minister on behalf of NEFIT on the meeting on Thursday, that we would look at asking the HPSC to develop guidance for the interpretation of social distancing requirements in the hospitality sector during periods of low transmission. We think we could make a further contribution, if you like, to the continued assurance of safety of both staff and customers in the hospitality sector over the course of periods of low transmission, while recognising that there would be a continuing challenge for them in meeting some of the restrictions. So that's work that we're doing at the moment, and we'll give further advice to government when we've completed those pieces of guidance.
One more from me then.
Sure.
Just in terms of cancer screening, a lot of concern expressed over the weekend from people who, they feel that priorities are somewhat askew, that people now know when they can go for a pint, but they don't know when they can go for a smear test, for example. Like, they feel that this is something which hasn't been really thought through. What would your response be to that?
It's not that it's not been thought through. It relates, like any activity, to the risk that is involved in that activity of transmission of infection. You simply can't equate going for a pint and going for a smear test. These are two totally different things. The risk that's involved in the transmission of virus are 2 totally different things. There is, at a very advanced stage now, work happening in the HSE to develop detailed plans for the re-establishment of a range of different components of what you might call non-COVID healthcare activity, of which screening is an important part. And we'd hope to be in a position very shortly to set out what the plans will be in that regard. Thanks.
Tony, if I just want
Sure,
to,
please.
just very briefly,
Please,
Richard,
yeah.
just to say to you that while there is not screening up and running yet for asymptomatic disease, if people have symptoms of disease, there is rapid access screening and rapid access care. So if people do develop any symptoms, please go to your doctor.
Thank you.
Thanks, Richard. Sinead?
Sinead Crowley from RTE. We saw a lot of people today did go back shopping. They took the opportunity to go into town, but the wearing of masks still seems to be a bit of confusion there. A lot of people anecdotally aren't wearing them. I know they're not mandatory, but can you just reiterate again, what is the advice for people if they're particularly going shopping in crowded places with masks?
So the advice from our point of view, which is consistent with advice in other jurisdictions, it's consistent with guidance and advice from international organisations. We recommend the use of masks in retail settings, in other indoor settings where social distancing might be a challenge, and on public transport. We think it's an important additional hygiene measure. It does not take the place of all of the other measures that we have in place from a public health point of view, but we think that this can give additional protection in those situations in which maintaining, if you like, some of the other requirements might be challenging, and so that's why we recommend it in those sectors. I do recognise that people are wearing them in other settings. I think part of the advice that we give is about how masks are worn. It's really important, because if masks aren't worn properly and aren't taken on and taken off properly, and properly cleaned and washed if they're cloth masks, and discarded and replaced if they're not, if they're touched inappropriately and so on, it can actually lead to further an increase of risk. So it's really important not just that people wear them, but that they wear them properly. Really important they see them as being an add, but not a replacement for the measures they take. I was shopping myself on Saturday afternoon. I wore a mask in my local Dunnes Store shop, and yes, I did notice that the majority of people were not wearing masks. It is our clear recommendation for those reasons that people in those settings should wear, and maybe the shops and retail environments might take steps to remind the public of the importance of sticking with the advice that we're giving.
Okay. And I suppose another issue that arose today with people going back to work in retail is the lack of childcare. Has NEFIT or can NEFIT do anything else to maybe speed up the availability of childcare, or give advice to people who now simply can't go to work if there isn't care available?
So we've given a lot of consideration to this on public health grounds. We've worked with the relevant departments, in particular the Department of Children and Youth Affairs. The guidance that's now available and developed will provide a basis upon which childcare can resume, and I think the remaining period of time between now and the point of implementation of that is required for the appropriate preparation to enable that guidance and advice to be properly implemented.
So there'll be no speeding up then, it's still the way it's
Well,
laid out.
from a public health point of view, when the relevant sector is in a position to implement that guidance, then we're okay with its implementation, but we think it'll take until then, yeah.
Okay, thank you.
Thanks, Sinead.
Shane Beattie from News Talk. The contacts of confirmed cases, it's gone up from below 3, I think, in April to above 4 now for each of those confirmed cases. Obviously, that's somewhat inevitable as people begin to move around more. You're strong. You want people to really limit their contacts. Can you just elaborate a little bit more on that, or even Dr. Glynn, if you want to, just because we've seen within a month or so for each case it's gone up from 3 to 4, and what can we likely expect?
So it's difficult to say what we can expect, but it's not surprising that the average number has gone up a small bit, given that we eased restrictions a number of weeks back. Clearly what we don't want to see is that number continue to increase. And I suppose the message to people is that if you are meeting people, which people will be doing, is to try to meet the same group of people on a regular basis, rather than having a very wide network of people. If you're having meetings, if you're meeting with groups, try to have fewer meetings, smaller groups of people, and have them less often if possible. Ultimately, it comes down to individual and group behaviour as to how this will pan out over the coming weeks. So keeping to the same network of 6 people, or your same social network, will be very important. And obviously, as we've said, if you are meeting people, as much as possible, keep a log, so that if you do end up, unfortunately, becoming a confirmed case, your contacts can be rapidly identified, and they themselves then will be tested.
If I could just ask you, Tony, there's a letter today critical of, there's 1,000 signatories, some leading scientists who are critical of the overall strategy here, and they say basically that what we're doing is that instead of suppressing the virus, we need to eliminate it. They say our current policy is to live with the virus under a long-term mitigation strategy. We have another option we can do, as many other countries have done, choose to suppress and eliminate the virus and crush the curve. Do you take on board that criticism of 1,000 leading scientists?
Well, I'll always listen to anything anybody has to say who might have a different perspective, and I think we've tried to do that from the beginning. I think there are language differences here in the words that are being used to describe the approach here. We've been clear from the beginning that from our point of view, if we can prevent infection, that's exactly what we want to do. Minimise the number of cases as low as it can possibly go. We've never said that we can see a level of infection in this which is tolerable when this infection is an infection which can lead to very significant and severe consequences in the way that this particular one can. There's no country that's in a position to say eliminate virus in the way that we talk about the elimination of something like wild polio virus, where we can say to the public that you can go about your normal business without fear of being infected with this, which is where we're in a position to say with something like polio in this part of the country. We don't think we'll be in a position to be able to eliminate in that sense. And so there's a continued risk of importation, there's a continued risk of infection, albeit at a much, much lower level now. We have the number of cases down to a very low level, and if we can get this down to 0 cases a day, then we'll be very happy. But we have to strike a balance. We cannot stay with the restricted measures that we have in place across society for any longer. We think now is the right time in terms of easing restrictions. We think that some of the evidence that we've seen from the practice of easing of restrictions in other countries, particularly across Europe, has shown continued reduction in the incidence of the disease and other important parameters of the disease, even after some of those restrictions have eased. We'll obviously watch that experience as we go along, but we think we're following the right strategy. It's a strategy that's worked here. And we think now is the right time for us to begin to ease restrictions.
And just one final one kind of related to that. So we have now New Zealand today, which has lifted essentially all COVID restrictions. It now says its nation is virus-free, and social distancing isn't required. There's no limits on public gatherings. People will be wondering, could we not have got to that stage?
And that's really good for New Zealand to be in that situation. It's a country at the other end of the world from the epicenter of this infection, which was Europe. Europe, a country obviously of which, or a continent of which we are a part, is an open political, cultural, social, economic group of countries. The comparison with New Zealand is not a reasonable one in that sense. The way in which Europe organises itself, our part in Europe as a small economy, open economy, is completely different to how New Zealand is organised. Its distance from its nearest landmass and its distance from the epicentre of the infection, which has been Europe.
Great, thank you.
Thanks.
Good evening. Just wanted to ask, did you have any sense of day one of entering into this phase 2+ as to how it's been going, or have you had a chance to look?
I haven't really. I've mostly hearing about it from you, the experience that's been happening over the course of the day. But I think we've arrived at a point now, we think, where with the commencement, if you like, of retail right across, the increase in social and activity, in particular relation to children that we've recommended. But it's too early for us to begin to take stock of what any impact that has been.
Okay. I don't know, did you have a chance to look? There was an extensive guidelines published by the hairdressing industry today as to how they might handle social distance.
Those yet.
You haven't looked at those yet? Or
No.
Will you take a look at those, or will you get a chance to, do you think?
I'm not sure that I'll get a chance to very soon. What we want to see happening is relevant sectors and organisations beginning to internalise and take on board our guidance and advice. And we think that's what's happened right across society. And we will be looking now over the course of the next 3 weeks at what the impact of that has been during phase 2, and then doing the work to rephase the remaining measures, of which hairdressing is one, into one or other of the 2 remaining phases. And any information that we think is of relevance to us to do all of that work is work we will do over the course of the next period, and we'll come back to government with advice as to how we see the remaining measures that have to be taken being phased into either the next phase, which commences from the 29th of June, or the final phase, which commences from, I think it's the 20th of July. And that all obviously is on the assumption that we continue to have the experience we're currently having in terms of low levels of transmission of the disease.
Okay. And just from the press release, the outbreaks in workplaces, there's 22 in the meat factories. Is there any data or details on the other type of workplaces that relate to maybe 25 other outbreaks?
I don't have it, but there's no strong pattern. It's a mixture of workplaces. There's no cluster or firm pattern like there is with the meat and poultry processors. And
there's a statement there about clusters in family homes, 16 clusters last week. Is there anything to compare that to? Is that a rise, or is that in there for any reason?
So the week before there was just 6, so it is an increase. Now, it's not surprising that you get clusters in private houses. We know from experience internationally, again, that as you drive down the spread of the virus, of course, you're going to see more in private households. But I suppose it's a message to people that, again, if you have symptoms, don't spend a couple of days in your house wondering whether to contact your GP or not. Treat this differently to how you would treat what might otherwise be regarded as minor symptoms. Isolate yourself from your household and contact your GP straight away and get tested if necessary.
Okay, thank you.
Yes,
Good evening, Michelle Hennessy from the Journal.ie. There's obviously been a slight increase based on the HSE data in the number of contacts that positive cases have in the last few weeks. But it doesn't seem like from the figures that those people are contracting COVID-19. So would that be a fair assessment? And if that's a fair assessment, why do you think that is, that they're not catching it off the people they're in contact with who have it?
So it's still the case that just because you're a close contact doesn't necessarily mean that you'll get the disease. The risk of getting the disease is not, it's high, much higher than the general population. But it's not necessarily the case that you would expect to see every close contact developing the disease. But if you look at the rate at which contacts who are tested now, and that's now our policy, are being identified with the disease, there is a percentage of people who are picking up this disease as close contacts, much higher risk than the general population. So the most likely place, obviously, that you will get this is by being a close contact of a confirmed case.
And just another question on the clusters that you're seeing in private households. Are we seeing now the majority of transmission in private homes?
We think that we're seeing, when we look at, and it gets difficult when the numbers get down to as low as this, to draw significant patterns. But when we look at, say, over the course of a week or so, we're seeing that in about half of the cases are connected to clusters that are either occurring in some workplaces, and we've talked about some of these, or clusters that are occurring in residential care facilities. The other half of the cases are isolated cases that occur in the community, and that we're not able to connect to individual outbreaks, and they're part of either isolated cases or family outbreaks.
Okay. I know
By
you said
family, I mean households, yeah.
Yeah, okay. You said before that the asymptomatic transmission it's not something where you didn't realise how significant it was, let's say, to the transmission of this disease in earlier days, and now we know that it can be quite significant. Do we know how a person who is asymptomatic is passing on the disease to somebody else? Because obviously if you're not coughing, you would imagine that there aren't particles. Is it just their closer contacts, like maybe a spouse, who are most likely to catch it from somebody in that situation?
There was a certain amount of viral shedding that does occur, clearly, that isn't really seen as part of, when you wouldn't necessarily expect from other viral infections, including other coronavirus infections like SARS, when we had SARS 20 years ago, or like flu would normally transmit, and that's now clearly established, if you like, as a scientific fact, that a certain amount of viral shedding happens, and it's not just through droplets, but it's also through contamination of hands and so on, and we've emphasised that, if you like, from the beginning as an important means of transmission of this particular virus. And yes, you're right, it wasn't something that was known or suspected at the beginning. There was a strong belief that being symptomatic, producing large enough virus, producing through coughing and sneezing and so on, droplets, that was all essential to the spread. And right up to including the second half of March, that was believed to be the situation by the international advisory bodies. That's now a situation that has changed in terms of the advice, and we take full account of that now in all of our arrangements in terms of asymptomatic transmission, including the contact tracing, which goes back to the point 48 hours prior to the onset of symptoms in a given case.
Okay. Just one last one from me. Do you know if the study to test for immunity in the population has started yet? I know it was due to start sometime this month.
It's due to start later this month, yeah.
Okay.
It is,
Thanks.
yeah.
Hi, Jack Horgan-Jones from the Irish Times. I just wanted to ask about the GAA put out some figures this morning, I think, suggesting that they could see a kind of socially distanced crowd of around 42,000 in Croke Park. How would you feel about 42,000 people coming together, not only in a stadium, but travelling to the stadium, congregating afterwards?
I haven't seen what the GAA has put out. I've seen some material that they produced over the course of the last number of days, in particular some material they put out very much directed at clubs and other organisations to, I think, initially focus on getting safe and appropriate training and games, in particular involving children, going as early as possible. I think they've done a terrific job. I think it's a terrific organisation, and the way they've approached all of this. They've worked with us behind the scenes, and I couldn't speak highly enough about them. But I haven't seen that detail of that plan that you're referring to.
Okay, perhaps then, without reference to any particular instance, the idea of tens of thousands of people gathering in even socially distanced stadiums, is that something that you could see yourself backing at any stage this year?
See yourselves banning? Did you say?
Backing.
Backing, sorry.
Supporting.
We think now still we're not making any recommendation in relation to indoor or outdoor mass gathering, other than we think that they shouldn't take place or they shouldn't be planned at this moment in time. I haven't seen the specifics, so I'm not being drawn now on the specifics of what the GAA has said. I say again, I think the GAA has been steadfast in its support for everything we've done, whether that's been in terms of implementation of the guidance and advice around the games and what they plan to bring forward for children, or whether it's in supporting some of the community call initiatives that have been involved in supporting local communities. They've been terrific.
Can I get you to, I want to return to the issue of face masks, because obviously, anecdotally, there's not been great compliance. We've already discussed that. If there isn't good compliance, if we don't get the sense that the population is rowing in behind this, is it not logical to see that becoming mandatory at some point?
It isn't necessarily logical. I think that we can get further progress on implementation of that guidance, and I think we can do better. I think part of our reluctance in moving in the direction of mandatory is because we know the evidence isn't absolutely firm and clear. The scientific consensus is not firm and clear in relation to face masks, but we believe it's sufficiently robust for us to, when we think about that guidance, when we look at things from a precautionary point of view, for us to recommend the use of face masks as an additional measure in the settings in which we have identified indoor settings, particularly retail and public transport. We think it'll be an important additional hygiene measure. But we are sensitive to the fact that some people cannot wear face masks for medical reasons, and there are good reasons why that may well be the case, and so we are stopping short of making it mandatory. But we'll keep all of this under review, but right now I don't see us having a change, but I think we will redouble our efforts, and we'll redouble our efforts to advise the public about the importance of wearing masks in public and in retail situations, which is why we keep stressing it.
Were you concerned about what you saw on your own trip to the shops, or indeed what people have been telling you about what they've seen in terms of compliance?
No, I could see that the level of compliance wasn't high, but I could see that all the other measures that were in place in the shop I was in were really good. So the retail organisations, and I've said this on a number of occasions before, have been really responsible in how they've gone about putting in place arrangements to support their customers and their staff in protecting themselves, and we've seen that in that we haven't had reported clusters and associated with retail to any significant extent. And as we have maintained, if you like, retail, particularly in terms of things like grocery and other essential services, we haven't seen a challenge. We think that the retail sector has done a really good job there. But we know that retail is going to become more a feature of all of our lives, which is a good thing. We'll get out and we will visit shops more, and we think it's an important measure that we will need to redouble our efforts to implement, if you like, more use of face coverings in those situations.
Just finally from me, you mentioned earlier on about perhaps varying the 2-metre rule in times of low transmission. So does that mean at a time like now, perhaps, when there isn't a lot of virus circulating, it might be 1 metre, and then if you see an uptick, it would go out to 2 metres again?
I wouldn't go quite as far as that. We're specifically talking about the challenge of implementing social distancing requirements in the hospitality sector at particular periods in time. Now is not the point or the phase at which we're talking about restaurants, for example, coming back and providing services. That's something that we don't see happening before the end of this phase. What we'll do now is develop the guidance and make that guidance available so that restaurants can incorporate that into their ongoing planning, and other parts of the hospitality sector can incorporate that into their ongoing planning to try to ensure that, if you like, the totality of guidance and advice that they can implement has the greatest chance, if you like, of giving continued assurance of low risk of transmission. This is during a period of low risk, when the level of virus in the population generally is low, and to give greatest assurance to their customers and their staff, while also recognising the need for us to be able to restore those important parts of our society and our economy, and the experiences that probably everybody wants to be able to have, to go back out and to enjoy a meal and to enjoy the experience of what the hospitality sector offers.
Thank you.
Thanks, Jack.